Hi, welcome to the Inpatient Rehab Unit. This presentation will be your welcome and a bit of orientation for you joining this unit. I hope to be able to answer many of the questions you have as you're coming on as a new associate to this unit. But of course, I will always be here to answer any further questions you have after viewing this presentation. What I hope that you gain from this presentation is that you'll have a better understanding of the nursing expectations according to the inpatient rehab unit, that you'll be able to recognize how the inpatient rehab unit will differ from some of the other inpatient units at this facility. And I also hope that you would understand how to implement a multidisciplinary approach to provide the best patient care possible. The three cues and competencies that will be discussed throughout this presentation are teamwork and collaboration, patient-centered care, and safety. Teamwork and collaboration is how we realize how to function effectively within nursing and interprofessional teams. We foster open communication, mutual respect, and shared decision-making to achieve quality patient care. Patient-centered care recognizes that the patient is at the source of control and they're a full partner in providing compassionate care and coordinated care based on respect for the patient's preferences, values, and needs. And lastly, safety. Safety is to minimize the risk of harm to patients and providers throughout both the system effectiveness and individual performance. A little bit about our inpatient rehab unit. This unit was established within this facility in July of 2023, so we are coming on about our 2-year anniversary. This unit is managed by another entity that's a contracted agency. They own multiple, actually hundreds of rehab facilities throughout the nation. Some of them are standalone and some of them are in a hospital, such as this one. But all of them have the same goals and standards for all of their patients. The contracted agency is who employs the physical therapy, occupational therapy, speech therapy, and case manager for this unit. The hospital facility employs and manages the nursing staff for this unit. A little bit just about the facility and in general. We actually had a rehab unit when about 10 years ago. It was actually on the same unit that we are currently housed. It was a rehab facility, but it was not contracted by another agency such as this one. It was completely owned and operated from this hospital setting. So this is a little bit different in the fact that it has a contracted agency, but it's kind of come full circle in the fact that we are now doing a rehab unit again on this same area of the hospital that we currently are doing this on. The benefits of inpatient rehab. Patients who qualify for the specialized inpatient rehab programs experience an increased independence in mobility, transfers, and activities of daily living. The goal of all of our patients is actually to go back to the home setting. So this increased independence is absolutely very important for all of our patients and the families in which we serve. They also have the benefit of having shorter lengths of stay. Some patients often end up staying longer in the hospital setting because they're not quite ready to get back home. Family doesn't feel safe for them to be back in the home setting, and maybe they're looking for placement such as a nursing home or long-term care facility or even a skilled swing bed setting. So having them come into the inpatient rehab unit helps them get stronger with the intensive therapies that we do down here, and in the end can definitely cause them to have a shorter length of stay for their total hospital stay. The inpatient rehab unit also is billed separately, so by having them have a place to go and actually discharging from, say, the acute care setting or a surgical setting, that will help the hospital and that patient having that shorter length of stay. And now they're on a new unit to have a whole new stay. So I know that sounds a little bit confusing, but overall this is very good for both the patient and the facility as far as how billing comes to be. They are seen daily by a physician and nurse that has the oversight. So unlike maybe if they went to a swing bed facility or a long-term care facility, of course, or even assisted living, this unit was housed, like I said, within the hospital setting. We have a physician designated to us that sees the patient every single day. And then there is 24-hour nursing care that's providing cares to these patients and ensuring that they are medically stable and just taking care of all their needs. And that's you that has come onto this unit who's going to help oversee these patients. And then it has lower hospital readmission risk. So by getting them back stronger, back into the home setting, we're addressing many needs while they're in our unit. It helps set them up for the best success. This definitely will help to prevent them from having to be readmitted in a short period of time. So that is definitely a major goal for us, is to get them home and to keep them home. Some more benefits from our inpatient rehab unit. So this inpatient rehab unit provides the patient the opportunity for a better recovery. Maybe, and we'll go over more diagnoses later as to what kind of patients we actually see down here. But just for a quick example, if we have a patient that maybe fell and broke their hip, this can be a debilitating condition for them. But by allowing them to come into our inpatient rehab program, they will be able to have that strength, and we will be talking with them to help prevent the risk of further falls, and their overall recovery is much improved, so they're able to get back in that home setting and succeed within that setting. The more intensive therapy and treatment provided in this inpatient environment often helps that patient make better, more complete recoveries than they would with the less intense programs, helping them achieve just a greater level of functional improvement and independence. So this just option, like I said, has intensive therapy. We'll talk more about exactly how much therapy these patients will receive, but it is much more than you would see, and again, in a skilled or a swing bed setting, that would be another option maybe for them at discharge. By having them come into the inpatient rehab unit, we're able to just really get them in a space where they can have a lot of functional improvement. And again, that independence is a big key to this piece of the puzzle here. Some of the injuries and illnesses treated. So we see a wide variety of patients, but here's some of the main diagnoses that we see. So amputations, patient with aphasia, arthritis and joint conditions, brain injury, diabetes, gait disorders, hip fracture and other traumatic fractures, joint replacement, and stroke. Stroke is a big one for us. We often see patients that have had a major stroke and have residual deficits. So whether it's slurred speech, imbalance, weakness to one side or the other, double vision, we see a wide variety of course, post-stroke deficits that our therapy team and nursing team can help get the patient to a place where they feel comfortable getting back home. We can maybe even lessen some of the deficits that they have during their stay here. But even if they are going to be lifelong deficits they have, we can give them the tools to use and to be successful when they get back into the home setting. So nursing responsibilities. So again, that's you. You're a nurse that has come onto this unit, and now you need to know what is expected of you. So just as any other unit, so like our acute care, our surgical units, we have many of the same responsibilities that you would have in that setting. So we of course are doing medication administration. You are responsible for doing a full body assessment every 6 hours. Vital signs are every 6 hours on this unit, so that differs a little bit from most of the other units who are doing them at the very least every 4 hours. We're of course following physician orders just as any other nurse would. We're monitoring vitals, lab work, radiology reports, and the patient overall condition. And then we are in communication with our doctors to notify them of any patient declines or change of condition to ensure that we are addressing any needs that the patient has. And then we are, of course, doing all the documentation that other units are as far as charting those assessments and vitals and notes and everything else. But there are a few other things that on our inpatient rehab unit that we are doing specialized. We have specialized assessments, and one of them is called the IRV-PI. This is actually an inpatient rehab. It's checking from their admission, what state and conditions they're in, and all the way through their discharge. Now, what state are they in? So we are looking at them from their first 3 days of admission to their last 3 days before discharge and comparing the two. This all has to do with the billing on the backside of what we did and the cares that we provided on this unit. We also are doing care plans and weekly reports. These are all specialized and specific to this inpatient rehab unit. These are all actually currently in a paper form still, as we are still filling those out. As you're going through your orientation, the nurse coach that you are with will help you navigate where to find these and how often and when to complete these, and also where these will be housed. These are actually filled out from all different entities that are on this inpatient rehab unit. We all have our different sections that we fill out, from nursing to the physical therapy, occupational therapy, and speech therapy, and then the physician also has portions that they must complete. So this is definitely a team effort in getting these specialized assessments and forms completed. So what can a patient expect from their stay on our inpatient rehab unit? Our goal, as I've mentioned a couple times already during this presentation, is to return all patients to the home setting. We want them to be as independent as possible before leaving. We do, of course, have moments where patients do need to come into a assisted living setting, or even times when maybe a medical condition starts to arise a little bit more, to where they need to go back to the acute care setting, where we're not able to continue doing the therapies because of the medical condition. But the absolute goal and intention when we bring a patient down to our unit is that we want to do the best that we can to get them back to the home setting. Our especially trained rehab and internal medicine specialists will be available to see our patients. So we have 2 designated physicians that see our patients down here. There's 24/7 hospitalist care as well. Our 2 specially trained physicians are hospitalists within our facility, but only 2 of them rotate to have continuity of care for these patients to ensure that the plans for them are continued through the stay. They have gone through special training course modules and have to be approved and signed off by the contracted agency to be able to see the patients and document on the patients within our unit. Patients are expected to be dressed during the day in their everyday or street clothing. Staff will be there to assist dressing as needed. As you'll soon find out on this unit, we want patients to be able to, again, do as much as they can as possible. Us as nurses sometimes struggle with this. We always want to help and assist patients, but we often have a hands-off approach here, and we want patients to do as much as they can. We are there to assist them, but we want to be able to assess where they are at with their independence at all times. But this is something to communicate with family. If you notice as a patient comes down to the unit that they're still in a hospital gown, maybe from their acute care stay, or only have dirty clothing that maybe they came into the emergency room with from their original stay. This is communicating with the patient and their family members to ensure that they're bringing some clothes that they can get back they can get into during their stay here. That is all part of their therapy. We are a transitional unit. We want to see patients not in a hospital gown, because we are no longer at that point in their hospitalization journey. We are transitioning them back to get back out there into the public setting, and we would not want to wear a hospital gown in our home or our public settings. So this is a part of therapy, ensuring that they are wearing street clothing. Patients are expected to participate in 3 hours of therapy 5 out of the 7 days per week. So this mostly falls on a Monday through Friday schedule. Every once in a while, a therapist will be scheduled through the weekend for patients maybe admitted later in the week. But they are completing 3 hours of therapy. So this includes physical therapy, occupational therapy, and speech therapy. And those 3 hours are spread through them all those entities. We also do schedule them throughout the day. It is not 3 solid blocked hours, but it allows for rest times. We also ask that visitors just be respectful of that time that they may need for recovery, knowing that they're going to be pretty tired after all that work throughout the day. Meals are served in our dining room. So this is also unlike your other acute care setting units. We have a dining room on our unit. We do expect that at least one meal for the patient is served down in the dining room, and that the patients are eating in a community setting, social setting, and most of the time we do this at our lunchtime meal. Family is huge to our patients, and we want them to be there because they're the ones that are going to be there after they discharge from our unit. So definitely towards the end of their stay, when they're about to discharge, we invite families to even come and participate in the therapy sessions. The therapist will watch them as they care for their loved ones. Like if it's a husband and a wife, and you know that the spouse is going to be the one that's going to be the main caregiver and support for them, the therapist will often just be there to observe them doing the transfers and them doing any of the cares needed for the patients. Our clinical team works together to come up with discharge dates. We often already have that date figured out within just the first couple of days of them being down there. As we are working through their plan and their goals, we're also working alongside our family and caregivers to make sure they're prepared to be able to have maybe the home setting ready for them when it is time to discharge. So multidisciplinary approach. I mentioned a lot of different team members on this for this unit, and so we're going to talk a little bit about how we work together. So the benefits of having that multidisciplinary approach. This unit I think is just so special in the fact that it's a true multidisciplinary approach where you have multiple entities working hand in hand together. So we're fostering a collaboration among those various professionals. As I mentioned, we have nursing, we have physicians, and different therapy entities. We're enhancing communication and trust. So we're constantly communication and working together to provide the best care for patients, and we're improving healthcare outcomes by doing these things. So who is a part of our team? So this circle here almost represents, to me, it looks like a round table. So who's all around this table? We have a physician, we have nursing, we have the program director, and that's from that contracted agency for the therapy group. We have a case manager to help with discharge needs and any other needs throughout their stay. Speech therapy, physical therapy assistant, occupational therapy assistant, and then just a certified therapy assistant. All of these members play very large parts in the care for our patients. And how this team works together, so we do get together kind of like how that picture represented as a round table. Once a week we meet together to discuss the goals for the different entities and the progress they're making. Daily we're collaborating amongst each other to work together for those goals. We help each other out with the goals. As therapy sets different standards for the patients to be able to meet, nursing is right there to understand what those are so they can also support them. And then we have scheduled therapy times. So our program director schedules the therapy out for the patients the day before so that nursing is aware of when therapy needs to be with the patient so they can also get their nursing cares done as well. So they are definitely in communication about that and trying to keep them on the schedule so that patients know what to expect for their day. All right, let's see if you learned anything from this presentation. So just take a moment and I want you to try to answer this question. So can you name 3 benefits of inpatient rehab? All right, so here's a few of them. So increased independence, shorter length of stay, and decreased rate of hospital readmission. So hopefully you were able to maybe think of a few of those. All right, how often do you remember our nursing assessments to be completed? This is every 6 hours. So this is similar to our acute and our surgical units, who is also doing the assessments every 6 hours. All right, how many hours of therapy are patients expected to participate in each day? 3. So this is 3 hours, and like I said, it was spread between our physical therapy, occupational therapy, and speech therapy. All right, so welcome to our inpatient rehab unit. We are very glad that you are now part of this awesome team, as I've talked much about them throughout this presentation. We are just very glad to have you here. As always, if you have any questions or concerns throughout your orientation time period, you can always reach out to me, and we will do our best to make this a great experience for you being on this unit. So thank you for viewing this presentation, and we hope that you will enjoy your time with us.